مين اللي هيبدأ معانا يا جماعة؟
دكتور أحمد.
مم؟
اوكي.
مين من السامع مين؟
انا الحسيني يا فندم.
اتفضل حاضر. انت حظك جه في الحالة ده يعني هنعمل ايه؟
شكلها حالة مش حلوة.
والله الحالات بتاعت النهارده كلها مش كويسة.
والله يكرم. طب ممكن تقول كده من بدري.
والله عشان كده انا كنت مصمم اتكلم.
احمد بريكنج.
بس الدكتور حاتم معانا ولا لا؟ عشان الراجل بعت لي من شوية موجود. يا جماعة في كمان اسمحوا لي ان اقول لكم ان واثناء السيناريو ممكن هو يكتب لك لو انت بتدسكس مع الريلاتيف بيكتب كده assume that the relative take consent for the patient to discuss the condition with you. يعني الراجل حل لك قصة البريتش confidentiality. فبتبقى بعض الأوقات بتبقى مكتوبة في قلب السيناريو. يلا نبدأ. مستر كامل 58 years old and you are doctor in the medical outpatient clinic. Mr. Kamel had been referred to the medical outpatient clinic for further investigation of the right lung mass. A contrast enhanced CT chest was performed and the report is suggestive of bronchoalveolar carcinoma with mediastinal lymphadenopathy. However, the radiologist suggests obtaining a sample of this mass to confirm the diagnosis. Early in this day, your consultant speak to Mr. Kamel about his clinical condition and updated him regarding the result of CT. And he took consent from him for bronchoscopy, and the patient agreed for that. And he booked for bronchoscope after 1 week. At the end of the day, Mrs. Fatma, wives of Mr. Kamel, requested to discuss the condition of her husband with you. And you're tasked to explain the diagnosis and the future management to the patient wife, who is very concerned about her husband's unexpected diagnosis. اتفضل.
So good evening.
Patient was diagnosed as lung mass, and CT shows that he has lung mass with mediastinal lymphadenopathy, and the consultant requested for home bronchoscope, and the patient agreed for, and the patient signed consent, and bronchoscope will do it in the next week. And his wife come today to discuss with you the condition of her husband.
She's concerned about his diagnosis, and my task is to explain her diagnosis and future plan.
Yes.
Okay, so good evening.
The first time we'll do with me, Dr. Hussein, huh?
Yes, sir. Yeah, yes. It's an honor. Like to make it. So, good evening, Mrs. Fatma.
Good evening, doctor.
I'm Dr. Husseini, senior house officer from the outpatient clinic. Nice to meet you.
Nice to meet you too.
So, just out of respect, Mrs. Fatma, you are Mr. Kamel's wife, is that correct? Okay. I assume that Mr. Kamel knows about our conversation, and he agreed to discuss his condition with you. Is that true?
Yes, doctor. He came to the home today upset, and he told me that he has lung cancer, and the doctor has scheduled for him is a camera test in the next week.
I'm sorry for that, Mrs. Fatma, and he knows that that you are going to discuss his condition.
Yes.
Okay, Mrs. Fatma. So can you tell me what do you know about his condition up to now?
Actually, doctor, there is unbelievable condition. We went for GP last month with cough and chest problem, and he prescribed for him medication. And I requested from GP to request for him imaging of the chest, but he refused, and he told us it wasn't necessary. for him because it is a simple chest infection. But his condition doesn't improve and it is getting worse by the time. When we went back for GP to ask him for any medical diagnosis like imaging, he referred for my husband to the clinic of medical clinic. And the consultant requests for him imaging. And we are afraid that the consultant told us there is a mass in the lung. It is really a mistake from GP.
I can see your point, Ms. Fatma, and I'm sorry for that. Definitely, I'm not in a situation to defend of any of our colleagues, and we are a medical team. An error in the medical system is a failure of the whole system, and I will do my best to see where exactly the fault has been there, and I definitely will update you as regard the follow-up and the process is going on. But Mrs. Fatma, let me just explain to you more about his condition, if you allow me.
Yes, doctor, but this delay in the diagnosis could lead to delay in treatment. It could be affect the future life of my husband.
Yeah, actually, Ms. Fatma, up till now we are not sure about the definitive diagnosis. The definitive diagnosis will be done by taking the snip from your husband mass, and by that time only we can reach a definitive diagnosis. And if it is a type of nasty tumor, these nasty tumors usually grow very rapidly, and they reach an advanced stage beyond treatment very soon. And they usually are discovered much later, and moreover, their expression is usually very deceiving. Are you following, Mrs. Fatma?
Yes, doctor, I am with you. So that, as my husband told me, the consultant informed him could be high susceptibility of the lung cancer. Are you sure, doctor, it could be lung cancer?
I'm sorry, Mrs. Fatma. It looks that the CT is suggestive of lung cancer. I'm sorry again for that.
Could be other possibility, doctor?
It could be other possibilities, Mrs. Fatma, but in view of your husband condition and the imaging study, CT is highly suggestive of that nasty tumor.
Yes, doctor. Can he be cured if he undergoes a bronchoscopy?
Actually, Mrs. Fatma, this is a difficult question, and the bronchoscope will give us an answer. Will help us with that. But unfortunately, the condition is serious, and it seems that in the imaging that if it is a nasty tumor, which we are highly suggesting, it will be beyond curative, because it's not involving only the lung tissue, it's involving the other tissues surrounding, and most probably at that stage it's beyond curative treatment. The main treatment will be what we call it palliative. In other words, we don't cure or eradicate the tumor, but we are using our best to slow down the growth of the tumor, but we don't have a tool to cure it. Are you following, Mrs. Fatma?
Yes, doctor, I am following you, but there is late in the diagnosis for 1 month now. The GP give us a lot of this medication, and he ignore our advice to do imaging in his chest, and that lead to, as you told me, this disease could be going worse after that. Why, doctor, you book him bronchoscope after 1 week? Why you didn't? Why we can't do the bronchoscope today? Or what is the problem?
Actually, Mrs. Fatma, I can see your point definitely. And as for the first part, as regard the GB, we'll get touch base with him, and we'll contact the GB and get the full details of the situation there, so that we can have a better view of that condition at that time. And then we'll have another meeting, and I will discuss it with you and disclose what was the issue, and then we'll discuss what to be done next. And for the second part, as regard the bronchoscope is a procedure that needs adequate preparation and need your husband to be seen and reviewed by the anesthesia team and get him an appropriate preparation for the procedure. We want it to be a safe procedure, so we want it to be done by the expert and done by the expert hands in the appropriate settings.
Could this delay in the procedure will affect the progression of the disease?
Unfortunately, Mrs. Fatma, as I told you, the CT, the imaging scan of the chest is showing that if this is malignancy, it had spread beyond the curative. Most probably, if this is nasty growth, the management will be in the form of ablative treatment. In other words, as I told you, it's going to slow down the growth. It will not cure the treatment. So we want the snip to be taken to confirm the diagnosis and to know the underlying to check the adequate therapy for him. But still, it's not curative. It's only palliative. I'm sorry for that, Mrs. Fatma.
Okay.
Can I know what's going through your mind now, Mrs. Fatma?
I feel, Doctor, depressed about the condition of my husband. He is still young.
I'm sorry for that, Mrs. Fatma. That's we are all feeling sorry for him. And if you will allow me, may I involve the social workers that she might help you to cope with the condition. And also, if you allow me, after definitely getting the definitive diagnosis, you can hook with one of the association of the cancer family support that might help you to cope with the condition, because he needs you definitely in the next few days, and this will be maybe some pressure on you, and we are all here to help you. Is that okay for you, Mrs. Fatma?
Okay, Doctor.
Can I ask you one more question, Mrs. Fatma?
Yes, Doctor.
What's your concern at time being? Do you have any other concerns?
Yes, Doctor. My concern, my son is planned for marriage next year. Will my husband be well and alive until then?
It's again a difficult question, Ms. Fatma. First of all, let me congratulate you with regard your husband planning for wedding, your son planning for wedding. But unfortunately, if this is nasty growth is proven by the SNP, the survival, we are speaking in months, not definitely in years, and we are not sure that he will be surviving at that time. Is there any other concern, Ms. Fatma, can I help with?
Thank you.
Okay, Mrs. Fatma. This, if you allow me, this is some handouts for the bronchoscopy so that you can discuss it with your husband. And this is some title and websites as regard the information, as regard the cancer and cancer support groups that might help you. Is that okay for you?
Yes.
Okay. Mrs. Fatma, can I know more about your social support? What are you and your husband doing for life?
My husband retired and he usually take a pension every month, and we live with my son, and he is planning, as I told you, for marriage in the next year.
So financially, Mrs. Fatma, are you supported?
Yes, Doctor.
Okay, that's good news. And socially, we are all here to support you. And if you need any help, please don't hesitate to contact me. This is my contact number, and this is my full details. If you have any question anytime, we are all here to answer you.
Okay.
Okay. Thank you, Mrs. Fatma.
Thank you. You are welcome.
Time قد ايه؟
تايم 11 دقيقة.
ممكن نتكلم شوية كمان بقى، نعرف بقى كان بيشتغل ايه وله علاقة
والله
بالكانسر ولا لا؟
قاعدين بقى.
خلاص بقى بعدين بقى.
أنا جيت افتكرها دلوقتي يا دكتور حسين بس.
سألتها كان بيشتغل ايه؟ ريتاير ده خلاص بقى بيه.
طب وكان قبل كده بيشتغل ايه؟
عندك حق، كان فوق كومبنسيشن يعني، ممكن اسألها صح. طيب خلاص دي.
مهم. خلاص لو عاوز ترجع تاني
طب
مفيش
هي
مشكلة.
طب هي لسه ما مشيتش طيب؟ Okay, can I know, Mrs. Fatma, what was your husband doing for living before he can become retired?
He was a teacher.
He was a teacher.
Yes.
Okay, that's good, and that means that he liked to help others, and definitely we are all here to help him. What can I know more about his hobbies?
As usual, he is going to the club, playing football with his friends.
Okay, and what about do you have any surrounding environmental special circumstances like factories or anything else?
No,
Okay, Mrs. Fatma, thank you very much.
thank you. What's about summarization and checking understanding of the patient?
Yeah.
It's very important. If you read the, I told you before, all of us will have to read the how they making a mark for in the exam. Usually they make a mark for clinical for four skills: clinical communication, and the part of the clinical communication to explain to the patient the medical problem and to check understanding of this patient and summarize for the patient the conversation. So that summarization and check understanding both are included in clinical communication. If you forget to do that, you will lose definitely you will lose degree marks in the exam. It's very important to check understanding and summarize the condition for the patient.
Yes.
Very important thing in this scenario, we have to ask about the pre-morbid state for the patient. I mean that some social problem, job. It is very important to ask about the job. Very important to ask if this patient is smoker or not smoker. Why? Because you can explain to her what is the cause of the of the cancer of the lung. Because
even if she did ask for that.
Even he did answer. I told you before, there is some hidden agenda. Here in front of me in this scenario, she will tell you that how did he got the lung cancer. She will tell you, if you ask it about smoking, she will tell you, my husband has never smoked and he's relatively healthy lifestyle. How did he get the cancer without smoking? This is one of the hidden concerns. So that as a communication, there is a quote that say a communication is to hear what doesn't said by the patient. This one question in front of me that written in the paper. My husband has never smoked. How did he get the lung cancer? So that you have to ask about job, you have to ask about smoking, you have to ask about social life. You already asked about social life of the patient, who is taking care for the patient at home. Very, very important to ask about things. This patient you made for her breaking bad news. Why you doesn't over for her? She want anyone of her family to attend this meeting? At the start of, do you like any one member of your family to attend this meeting or no? Because you are going to making breaking bad news for her. Also, you have to offer for her help if you want. If you, at the end of the conversation, if you want anyone to drive you to the home, we can call social worker and she will arrange a person to drive you to home. Okay, Dr. Hussein.
Okay, تمام.
Someone may be, look, this is not important issue. You discussed a lot. Really, you discussed a lot in the scenario. But I will tell you what's happened for one colleague in the last exam. His condition was like this. He discussing with relative, and the relative was angry because some problem happened with GP, and he doesn't ask the patient how much you know about the father condition, and he start to explain to him your father condition is blah 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 blah, and finish the scenario. Typically, he was right in everything, but he didn't ask how much you know about your illness, about your father problem. Imagine what was the first question for the examiner after he finished the conversation. The examiner told him like that. Did you ask him, the surrogate, how much he knows about your father problem? And he takes in the communication 11 from 16, 5 marks because he lost only this question. He put that he doesn't make clinical communication and making rapport. He wrote that in the comment. He didn't make rapport with the surrogate. Okay, if we are going to check for this scenario, what is the ethical issue? You can tell us. Obscene. Hello.
أيوة.
تفضل.
Ethical issue first of all is the autonomy of the patient. We are preaching confidentiality, so the patient has the autonomy.
Yes.
So that you have to be sure that the patient knows. Giving a consent to the wife to discuss the issue.
Yes.
And the second thing is breaking bad counseling the patient and dealing with angry patient. She was angry because of the delay in the diagnosis. Also governance, because we have to give a feedback with regard to the GB diagnosis and missing misdiagnosis. And lastly will be the justice, because it's not in that scenario, but it might come later on. She might ask for futile management, because obviously from the CT the assignment nodes are involved, so it's most probably stage 3 or stage 4. So he is only candidate for chemo or radiotherapy palliative treatment, and this was slightly raised when she was asking about the cure. So this is justice, and I think that's it. I don't know if there is anything.
Medical issue in this patient?
The medical issue is explaining the diagnosis to the wife, and the urgency of the bronchoscopy, and the future management after the definitive diagnosis.
Okay, I want for you to emphasize about important point. This patient has uncertain diagnosis. Until now, we are not sure about the diagnosis, and the tissue biopsy will tell us two things. If this patient has a cancer that highly suggested by CT or has other cause for cyst problem. That you have to emphasize. Until now, we don't have the nature of this disease, but it is likely could be cancer. Okay, you have to tell the patient like that. And also according to the result of investigation of this tissue biopsy, we can decide the plan of management. So that this case, in this case, it's uncertain diagnosis. This case came before, and one similar case for her I think came before in Egypt, 2012 in January. It was suspicion of cholangiocarcinoma. Still by CT, and he want MRCP to make tissue biopsy to confirm the diagnosis. كويس يا دكتور حسين والله.
Just I want to add one moment. The last exam, one patient failed, despite he has more than 130.
Yes, 130. Yes.
Because of this.
Yes, this is a good thing.
He told you have cancer, and it's just suggestive. There's no biopsy result. Yes. Because he get 0, patient will fail in same station.
Yes. To get pass, you have to pass in all stage, in all clinical stages, and the communication and the history in patient welfare. Maybe patient welfare total you have to came 28 from 32. But if you lost 4 marks in one patient in one station, you will not pass. صح كده يا دكتور مالك؟
كلامك صح.
فلو انت فقدت 4 درجات مرة واحدة في حالة
0 on one station
خلاص
for welfare
في الورفير
could be not always but most probably
because the case it was uncertain diagnosis.
بعدين حضرتك يا دكتور احمد، طب هنا when she asked him my boy will marry next year, I think he will give her wrong information like this. He should tell her it's early to answer this question.
I am going to ask him about that. We didn't know what will happen in the future. According to the result of this tissue sample, we can take plan of management. As I told you, it could be type of cancer, could be other cause. But if it is a type of cancer, we are speaking in some patient different from other patient. But we are speaking in months, and delete this opening issue for here.
So there's a point that I will tell her again, as we mentioned, that we're still waiting for the biopsy. But
yes.
If it is coinciding with the CT, it's an issue of months.
CT is highly suggestive, but it is not sure diagnosis.
Yeah, no, I mean the staging of the CT. Then CT is giving a very bad stage. So we are waiting for confirming the diagnosis. If the diagnosis is confirmed, so we are if the diagnosis is confirmed, we are speaking a matter of months. This
yes.
would be the appropriate answer.
Yes.
بعد إذنك يا دكتور أحمد, another question. We are dealing with an angry patient.
Yes.
So with one of the team, so he should tell her that we write an incident report about this. And
it is not a critical situation. Incident report if the patient exposed to risk, like allergy, or the patient is going to take wrong medication. But as Dr. Hosseini said, we will call the consultant and we will make a meeting because we are working as a team, and the end defect is defect in the organization, not in one person, and we will discuss this issue. And please, if the patient, don't enforce the patient to go to complain again. And if the patient is still angry and the patient is still shouting, don't offer for her to go to complain against GP. Because in the exam, some people told the patient you can make a complaint against GP. Any question? قبل ما نخش الحالة اللي بعدها.
Please, one question. Suppose he is the patient, not the wife. Do we need to ask about DNR?
Suppose what?
Suppose we are talking to the patient himself, not to his wife.
Are you sure about the diagnosis?
Suppose we are sure that the result biopsy done and the result is cancer. Do we need to talk about DNR?
Yes, but if that mentioned in your task, you can talk. But if your task only to explain the diagnosis and the management plan, you have to inform him, like Dr. Hosseini said, your condition is only cancer is go to other area outside of the lung, and that means only give you palliative treatment to decrease your suffering and to decrease the pain.
It is not part of management plan for all cancer patients, advanced cancer patients.
Yes, but if you raise this issue, do you mean that you will finish this issue in 14 minutes?
I think no.
It's a big problem because
if you allow me, Dr. Ahmed, if this is the first meeting with the patient, I mean, the news will be enough to predict him that he has an uncurative disease. I will leave the issue of the DNR for the next meeting. If this is the second meeting with the patient, then I might raise the issue and just let it to him. Like in the way of first meeting, I think telling him that he has cancer, it's non-curative, and they are going to put him DNR is too much for the patient to be given in one sitting.
Doesn't break too bad news for the patient in this setting.
for bronchoscopy can be arranged to be made early. No, this is simple procedure. No.
Yes, this is a simple procedure by the consultant request after 1 week. Why you are going to do it early? You are going to work against the consultant decision?
I can discuss with the consultant about the professional studies and
avoid to make a conflict between your decision and the consultant decision. If the consultant decides something, we have to follow it. Because maybe, as Dr. Hosseini said, there is a list, there is other patient in the list, and it's not emergency to save life for the patient.
yes.
So that this our case, breaking bad news, dealing with angry patient, and uncertain diagnosis. These three situations could be faced in the exam in each one alone. Could you meet angry patient alone, breaking bad news alone, or uncertain diagnosis alone? Next case. Who will share us with the next